My name is Joyce Hamilton, and I'm a person that live with AIDS.
Today, black women make up more than half of all women who have died from AIDS.
AIDS is growing faster in the African American population than in any other group in this country.
But there's a mispopulation, that young boy who's 13 to 18, who's on the down low.
There's a lot we do not know. Okay? And I'll say it again. There's a lot we do not know. And we need to know more. I have a passion, not because I live with this disease, because I don't want nobody else to get the disease.
The mission of Urban Solutions is to work with health disparities in the African American community. And today we're going to have a program on HIV.
On October 20th, 2004, Urban Solutions, a nonprofit health organization dedicated to empowering the community, invited an audience to hear some of Philadelphia's top health experts on the medical and social issues of HIV and AIDS in the community. Vital information that will assist you in making healthy choices in your life and in the life of your friends and family. You will hear firsthand the devastating effects of HIV and AIDS as it still continues to attack our African American communities in this nation.
19 years ago, I did not think that I was going to be here. And I thought I was going to be dead because, let me tell y'all, testing and counseling was totally different because it wasn't no testing and counseling. They just told you that you had this disease and you'd be dead in 6 months.
The earliest known case of HIV-1 in a human was from a blood sample collected in 1959 from a man in Kinshasa, that's the Congo. They don't really know how he became infected with this virus, but the theory is that it was by eating meat from animals that this virus got into the human chain. And so the genetic analysis of this blood sample suggested that HIV may have stemmed from a single virus in the late 1940s to 1950s. We know that the virus has existed in the United States since at least the mid to late 1970s. From 1979 to 1981, rare types of pneumonia, cancer, and other illnesses had been reported by doctors in Los Angeles, New York, Chicago, among a number of male patients who had sex with other men. These were conditions not usually found in people with a healthy immune system. In 1982, public health officials began to use the term acquired immunodeficiency syndrome, or AIDS, to describe the occurrence of opportunistic infections. Kaposi sarcoma, a kind of cancer, and pneumocystis, pneumonia, in previous healthy people were also part of this diagnosis. Now, the thing that we have to understand is that being infected with the HIV virus does not mean that you have AIDS. And many people can go with the HIV infection for a long time and not go to AIDS. But when you have these symptoms that I talk about, the pneumonias, other types, low counts and so forth, that's when you get the term for AIDS. So that's a good distinction to make. In 1983, scientists discovered the virus that causes AIDS. The virus was at first named HTLV3, LAV, or human T-cell lymphocyte virus type 3, lymphoadenopathy-associated virus. That was the original name of the virus, by an international scientific committee. This name was later changed to HIV, human immunodeficiency virus. For many years, scientists theorized as to the origins of the HIV, and it now appears, and how it appeared in the human population. Most believing that HIV originated in other primates. Then in 1999, an international team of researchers reported that they had discovered the origin of HIV-1, the predominant strain of HIV in the developed world. And we'll talk about this later. There are actually different types of strains of HIV. This is not one disease. We have different types of this disease. But the one that's most common here is the HIV-1. a subspecies of chimpanzees native to West Equatorial Africa had been identified as the original source of the virus. The researchers believe that HIV was introduced into the human population when hunters became exposed to infected blood. So this is the history.
The virus originated from a chimpanzee HIV virus. We do know that that virus existed within the chimpanzees for thousands of years. We know that because the virus doesn't make the chimpanzee sick, and that takes years of adjustment. A virus doesn't want to kill its host. When the virus kills its host, then it dies. So we know that this virus has been in the chimpanzee for thousands of years. I didn't understand the standard hypothesis that an African person killed a chimpanzee and the blood spilled in his wound, and that's how he got the HIV in 1950s, when we know they've been hunting chimpanzees for thousands of years. What caused that virus to suddenly jump from the chimpanzee to the humans? Now, what we do know for a fact is that the Worcester Institute, located here in Philadelphia, along with the Pasteur Institute in France, were developing, it wasn't a smallpox, it was a polio vaccine. They were developing an oral polio vaccine. That vaccine is grown in monkey kidneys.
That's right.
And one of the hypotheses was that in the development of this oral polio vaccine in the 50s, that somehow that led to that virus mutating and jumping to the humans. That's why it originated in Africa. That's why Africa has the highest rates in the world, and that it has disseminated into the rest of the world. It's strictly a hypothesis. There's no way to prove it one way or the other. They brought a commission together, and the commission recommended to the Worcester Institute that they go back and test their lots of vaccine, and the Worcester Institute refused to ever allow that testing.
I'm in the community from West Philly, from Germantown, from North Philly. I'm all over, even South Philly. And I do outreach. I distribute condoms. I give out information. And one thing that I see in the African American community is that our people don't want to hear about HIV and AIDS. And we need to be real about that. They are so sick and tired of hearing about it. They tired of looking at it on the billboard. They tired of being on the TV. They got this idea and this stigma that this can't happen to me.
AIDS was a disease basically among men who had sex with other men. Well, now that has changed, and we all know that, unfortunately, AIDS is now rampant in the African American population and is growing faster among African American females than any other group in our country. In this city, 78% of the cases of AIDS are among minority people, and 65% of those are African American people. It's very alarming. I read in the paper, it was in the paper about 6 months ago, that heterosexual activity is now the major form of transmission of AIDS. It's not IV drug use, it's not homosexual activity, it's men and women having sexual intercourse. That is the predominant way that the HIV virus is transmitted now.
There are definite cases of transmission in the community from patients, from individuals who have had oral sex, and that's something that needs to be our young kids need to be aware of that and taught that as a primary prevention point.
Evolving social norms. I'm talking about big time. The emphasis now is delayed marriage. Everybody lives together. The emphasis now, all young girls are having babies. Now, I don't mean teenagers. I mean them 19, 20, 21, 22. Right. It's okay to do that. Varied sexual experience. We're living in a time where it's cool to have multiple partners. It's a fashion.
The most significant type of sexual network is what's called the concurrent sexual partnership. What is a concurrent sexual partnership? A concurrent sexual partnership is a sexual partnership that overlaps in time. Another definition is that one or more of the persons within the partnership has other sexual partners while continuing to have sexual activity with the original partner. Concurrent sexual partnerships permit more rapid spread of an STI or HIV, a sexually transmitted infection or HIV, throughout a population, more so than if one has a monogamous relationship and then another monogamous relationship and then another one. Okay? An individual who is infected by one partner when there is a concurrent sexual partnership already has at his or her disposal other individuals who are at risk for being infected. Earlier partners, when there are concurrent relationships, are put at risk by their partner's subsequent partners.
They don't have problem-solving skills. Again, so how can you help me figure out, okay, I need to do this and I need to wear a condom? They don't have that. I don't need to do anything. I need to feel, okay? Because there's a need for innate emotional attachment. That's kind of a basic human need. The ability to make choices. I can't choose to have him use a condom. I can't do that. I can't choose to delay sex because I'm insecure. So what if my choices are not right? Anybody who knows me know I can see 10 patients in a day and 9 of them got it. And anybody who knows me knows this. This is, she talks about my red light district. Don't talk about my babies. They know that. And right there, I'm screening, talking, educating. And believe me, I'm taking care of adolescents with HIV, and it is one challenging task. Even though a family is not discussing it, or a care provider is not discussing it, these young people are sexual. And we have to bring this in the forefront, how if we don't teach them negotiation skills to negotiate safe sex practices, healthy relationships. It's so interesting that Dr. Godley was talking about concurrent relationships. Again, in the Pediatric Infectious Disease Journal just this year, they talked about how concurrent relationships in the adolescent population, that guys overestimate the concurrent relationships in young ladies, while young ladies underestimate. So in an effort, what you see displayed is this girl saying, I'm going to have unprotected sex with you because I want to show you you're my one and only. That's what they're doing. I want to show you it's just about you. Adolescents do not think on an intellectual level. That's what we're supposed to help them to do. They think on an emotional level. So when you say to them, what were you thinking? What do you mean, what was I thinking? You mean, what was I feeling? I'm feeling like I'm loving him right now, and nobody's understanding that right now. They're fragile. They have fragile communication skills. I can't tell you I'm hurting. I can't tell you, so I act out, right? I act out sexually. I act out aggressively, all right? Because again, there's issues of self-esteem and self-concept. I don't know what I want to be. This is what they're all going through, but yet they're hearing songs from Ludacris. They're seeing some video. When they can't control life's chaos, they control their sexual desires, or don't, and they don't control it effectively. I actually have patients who have told me I'm having sex unprotected, 5 guys and 5 girls. Don't miss that population, and nobody's writing about this group. Nobody. And we've seen them, though. We could be passing them. We've seen them. And this is your highest risk group because they're at the Vogue parties. They're having sex with that older man because that's who's going to embrace his sexuality. He can't disclose to his family. I got other issues. I'm a hustler. I'm doing this. I'm failing in school. You want me to tell you that I'm HIV positive? This is the group we can't miss. Young people want to be able to, they want to say, this is what I'm feeling. This is what I'm thinking. And they don't want you to come out of your mouth with nothing crazy. Just listen. Matter of fact, that's when you're supposed to go back to what I was talking about. If they're insecure, don't know how to make a decision, help them.
These are a lot of symptoms that that are consistent with overall flu-like illnesses, fever, lethargy, rash, and I'll actually show you a picture, myalgias, which are muscle aches and pains and headaches. And these are seen very commonly with a primary infection of HIV.
I'm in University of Pennsylvania every Tuesday in the perinatal clinic, and I see 15 years old, 18 years old. I see 19 years old and 25 years old talking about, I know my man. I don't have to get a test.
It is important to remember that HIV can be present in the body for up to 12 years without producing any outward signs of illness. So we have a real problem in front of us.
I support young people being able to get advice, being able to get condoms and any other help or assistance they need, and it be as confidential as they want it to be.
You have to be the referral source. If in your practice, or around, listen, you can go over to Urban Solutions. It's confidential. They ain't gonna tell nobody.
There is really hope for individuals that have HIV. And we've made a lot of breakthroughs from the scientific standpoint. In fact, the National Medical Association just had a conference a few weeks ago, and I went to that conference, and the speaker at the conference was telling me how a new diagnosis of diabetes is worse than a new diagnosis of HIV. With all of the new medicines we have, the protease inhibitors, the combination, some drugs that we have, if those medications are taken properly, the resistance that develops is much lower. You heard about that. Also, there's what they call resistance testing now. So they can test your blood and find out the type of medicines to give you which are not resistant based on that profile. And they can change that medicine block in relationship to the mutations that occur. I'm really so hopeful with the new vaccines that are being developed. And I don't know how many people are familiar with this, but I checked with the CDC, and there are vaccines currently now being developed. So maybe in the next 10 years or so, we will have vaccines that will both be preventive and treatment vaccines.
When you find somebody that's affected with the HIV, don't back up. Embrace them. Let them know that, keep on living.
We just have so much. It's just not about HIV and AIDS. It's that we have a life. Because I have AIDS, that don't give me the right to stop living. So I have a life.
If we are not in charge of our bodies, our health, and our lifestyle, we cannot be empowered to do anything.
So we have to make information available to youngsters, and we have to make information available to another community, and that is the community who's in shelters, the community who finds themselves on the streets, and that is also the community that is underinsured when it comes to health coverage or having no health insurance.
The amount of resources that are being committed to, so providers like Urban Solutions can outreach and reach the communities that need, both in terms of the caliber of the service that is being provided. Because if you provide a high caliber service, there is some considerable cost to treating folks with AIDS.
This information is power, and I'm prepared to act. Now, once we get the information, we have to act. We have to take it back to our homes, back to our community, when we have to deal with it with our children.
Let someone talk to you confidentially and be able to steer people to services that they may need.
So each of you in your own way, if you can, one, when you leave here, make a commitment to tell somebody, particularly somebody young, about the dangers of AIDS and HIV. Two, to tell them about how it can be prevented. And three, to contact some person with some decision-making authority, particularly at the federal level, to make sure that you let them know that it is important to you that we commit additional resources to deal with this deadly epidemic.
I believe if we love one another enough, we can make a difference. Thank you very much. God bless.
I have AIDS and I can still pass this disease on because it's not a cure. It is so many people in this community because I'm telling you, I'm going back way from 1985 when I walked into the clinic and people was going blind. People's face was so skinny. And when I walked into the clinic, I cried because I said, oh my God, this is what I'm going to look like. But look at me now, I'm fat. I am fat. And if I didn't tell y'all that I didn't have this, if I didn't tell y'all I had AIDS, none of y'all in this room would even know. My name is Joyce Hamilton, and I'm a person that live with AIDS.
Today, black women make up more than